Good morning. My name is Sharon Brigman, and my partner Mackenzie Marshall would like to discuss with you yoga. It is also known as a healing modality. So when we talk about yoga, what exactly is yoga? What does one think about when you hear yoga as a healing modality? Yoga is both spiritual and physical. It uses breathing techniques, exercises, and meditation. It is said to improve health and happiness. Yoga originated in ancient India and is one of the 6 orthodox schools of Hindu traditions. So we're looking at yoga originated thousands of years ago and it's still used today. Anyone interested in yoga can become an instructor. There are different levels of yoga. You have level 1 is beginners all the way to advanced yoga. Level 1 training for Yoga Fit which was recommended by my athletic staff here at the university. You can complete that, be certified in 200 hours. You will learn 46 different poses to teach an inclusive, well-rounded, and safe yoga. There are also, like I said, different classes. There are 500-hour classes, but to start with, all you would need is a 200-hour class. These costs can range from $500 to $5,000. Online classes are available as well, and personal training in areas that are possibly close to you. Upon doing the research, most classes offer payment plans so that you don't have to pay in full at one time. Upon completion of a class, you will receive certification. You will be ready to teach yoga in a group or class setting. So let's talk about yoga in the healthcare system. How can we use yoga in healthcare to help others? So let's talk a little bit more about yoga in healthcare. Yoga has not only been practiced by healthy individuals, but also ill individuals as a treatment option. Currently, it is used to improve health. It can reduce symptoms in asthma, eating disorders, schizophrenia, multiple sclerosis, anxiety, and depression. It's considered an effective way to promote health, strengthen well-being, and prevent diseases. Regular practice establishes suppleness, muscular strength, provides pain control, and increases longevity. So, if one would use yoga consistently, it is amazing the outcomes yoga can yield. You can have increased flexibility, increased muscle strength and tone, improved respirations, energy and vitality, maintaining a balanced metabolism, weight reduction, cardio and circulatory health, improved athletic performance, protection from injury, and the list goes on. So why would we not incorporate yoga into our daily routine? As I stated before, there are different types of yoga. There's also a type of yoga that's called laughter yoga that can provide stress relief. So as nurses, we endure occupational stress daily, which can compromise patient care, their caregivers' physical and mental health, and it contributes to the expense of staff turnover and replacement. Laughter yoga, or hatha yoga, is prolonged voluntary laughter accompanied by deep breathing and ending with meditation and relaxation. Each session begins with deep breaths and muscle warm-up exercises for 5 minutes, followed by 15 minutes of laughter exercises, then finishing with meditative breathing and guided relaxation for 10 more minutes. The article presented was a study conducted at a California community hospital to test the effects of laughter yoga on decreasing nurses' stress and compassion fatigue and enhancing their compassion satisfaction. Therapeutic humor is an underutilized modality intervention. Catecholamine levels increase in response to laughter, which improves mental functions and skeletal muscles begin to massage the internal organs, improving their blood supply. The initial increase in heart rate, respiratory rate, and depth and oxygen consumption are then followed by a healthy decrease in heart and respiratory rates as well as the blood pressure. Immunity may be boosted, pain may decrease, and the risk of heart disease may be lowered, all by just laughing. According to the study, laughter can also improve interpersonal relationships, increase friendliness, and build group identity and solidarity. How does yoga align with nursing theories? The two main theories discussed in our literature that yoga aligns with are Kolkaba's theory of comfort and Watson's theory of human caring, also known as transpersonal caring theory. Theory of comfort. Kolkaba described comfort existing in three forms: relief, ease, and transcendence. Comfort is assessed by feeling that you are in a state of comfort or having been comforted. Yoga supports this theory by providing physical and mental health benefits. Dr. Latoya Connor, clinical associate professor at Stanford University School of Medicine, stated, integrating elements of mind, body, and spirit balance, yoga therapy functions as self-care, health promotion, and health maintenance. Yoga can help manage symptoms from physical, emotional, neurobiological, and psychological disorders which provide comfort in stressful situations. Gene Watson's theory of human caring, also known as transpersonal human caring, focuses on health promotion as well as treatment of diseases. It argues caring is central to nursing practice and promotes health better than a simple medical cure. The transpersonal perspective acknowledges that all people are body, mind, and spirit, and the interactions between people engage each of these aspects of the self. Yoga can be incorporated into the reflective, meditative concept of this theory. Increased consciousness and presence to the humanism of self and others can be accomplished through practicing yoga. First, I will talk about Mackenzie's experience in yoga. Currently, she is a member of her county's YMCA program, and she attends weekly cycling and HIIT training exercise classes. She wanted to incorporate yoga into the weekly routine, so it was fairly easy to find a class that fit into her schedule. The class focused on the basics of yoga and involved fairly easy movements. She was so nervous in the beginning she didn't realize she was supposed to be barefoot for the class. Luckily, a kind lady in the class told her she needed to grab a mat and take her socks and shoes off. She was skeptical at first because the movements were so elementary. However, by the end of the class, a sense of relaxation had overcome and she felt more at ease. She also downloaded the Fit On app, which is great. It's a free alternative that she highly recommends for others when they cannot make it to the gym and want to practice yoga at home. The app also allows you to choose your intensity level and what parts of the body you would like to focus on. Overall, incorporating yoga into her weekly routine has provided her with relaxation periods and a way for her to center herself and perform mindful stretching. Yoga has improved her lower back pain. However, since she has been working at a beginner's level, she has not noticed any other physical improvements since starting the new exercise. There is also a short video link on this PowerPoint about the Fit On app, since most people do not know about it and its free services. So we will talk a little bit about my experience. I was able to do the yoga classes free of charge here at the university's fitness center. They do offer different classes, different types of yoga at different times, so I'm definitely able to fit a couple of yoga classes a week into my routine. Initially, I always thought, what was the hype about yoga? Like, I figured it would be too slow to have any weight loss or muscle strengthening benefits. I was not interested in yoga until I took this class and started researching other modalities for self-care. I will say, after this class, I was the most relaxed I've ever felt, but also feeling energized. As a busy mother of 3, it felt good to put my phone away and just relax my mind and body. I am definitely sold to yoga and will definitely incorporate yoga into my routine more consistently. Needless to say, I am sold. We hope you have enjoyed this PowerPoint presentation and will further research into yoga, knowing what benefits and outcomes that it can do for healing, just feeling relaxed, feeling better. Definitely for Mackenzie and I, we will definitely incorporate yoga into our routine.